Okay.
Hi, my name is Kayla Lepker. I'm a student at Maryville University in the FNP program. I'm completing my complete head-to-toe physical assessment or advanced health assessment. This is my patient, 24-year-old male. Before we started, I had him empty his bladder and put on a hospital gown. I washed my hands. We got a set of vital signs as well as his height and weight. We tested his sense of smell, which is the cranial nerve number 1, the olfactory nerve. And then we also tested his vision, the cranial nerve number 2, the optic nerve, using the Snellen chart for the distant vision and the Rosenbaum chart for the near vision. So I'm going to begin with my head-to-toe assessment, starting with the head. So first I'm inspecting the head, looking at the eyes and the ears, making sure they're both symmetrical bilaterally, making sure the nose and the mouth are both midline on the head. I'm palpating the scalp, making sure the skull is normal cephalic, looking at the hair, making sure the distribution is equal and the hair ends are non-brittle. I'm going to test the facial bones, so just let me know if you have any pain.
No.
Okay, next I'm going to test the sinuses, the frontal and the maxillary sinuses. So I'm just going to put pressure on and let me know if you have any pain. Any pain?
No.
Okay, next I'm going to test the TMJ, so I'm just going to have you open your mouth real big and then close. And I'm looking for any popping or clicking, and we're going to see if you have any pain. And one more time. Okay, good. So next I'm going to have you go through a list of commands that I'm going to say. And this is testing cranial nerve number 7, which is the facial nerve. So I'm going to have you wrinkle your forehead. I'm going to have you close your eyes tightly shut. I'm going to have you smile. I'm going to have you stick out your tongue, puff out your cheeks, and clench your teeth. Okay, and then I'm going to have you move your tongue, push it against my hand on that side and on that side, and that's testing cranial nerve number 12. Good. Okay, next I'm going to test cranial nerve number 5, which is the trigeminal. So I'm going to have you close your eyes, and I'm going to have you tell me if you feel this equally on both sides, if you feel it more so on one side than the other, or if you don't feel it at all on one side. Okay, good. So moving on, I'm going to look at the eyes. I'm looking at the eyelids, the eyebrows, the eyelashes. I'm looking at the hair distribution, making sure it's equal, making sure the eyelashes fan outward. I'm going to palpate the lacrimal apparatus. I'm looking for any nodules or pain. Whenever I do that, I'm going to inspect the conjunctiva, making sure it's pink and moist. I'm inspecting the sclera as well, making sure it's white with no yellow discoloration, which is good. I'm going to have you, I'm going to test your pupillary reflex. So I'm going to do direct and consensual. So I'm going to have you just look at the bridge of my nose here. Testing direct and consensual. Good. I'm going to have you look straight into the pen light here, and I'm going to test your red light reflex. Good. And that one is good. Okay, next I'm going to do the confrontation test to test your peripheral vision. So just let me know whenever you can see my fingers. Okay. And I'm going to do the cover test. And so I'm going to have you cover one eye. And have you just name whatever fingers I'm holding up.
1, 2, 3.
Okay, and then I'm going to have you do your other eye.
1, 2, 3.
Okay. Next I'm going to test the extraocular eye movements. This is testing cranial nerve number 3, 4, and 6, which is oculomotor, abducens, and trochlear. So I'm just going to have you look at the top of this pen light here and follow the pen light with your eyes only without moving your head, okay? Okay, good. Okay, moving on from the eyes, I'm going to go to the ears. So I'm looking at both of the ears, making sure they're symmetrical. I'm looking for any obvious deformities. I'm going to palpate the earlobes, making sure there's no nodules or pain whenever I palpate them. I'm going to look inside the ear for the tympanic membrane, making sure it looks pearly gray. and looking at the external ear canal as well, and making sure there's no wax buildup in it. Tympanic membrane is pearly gray. Okay, good. So the next thing I'm going to do is test the cranial nerve number 8, which is the auditory. So I'm going to strike the tuning fork, and then you let me know whenever you can no longer hear the sound, okay?
No.
Okay. So then I'm going to do the rhyme test, and I'm going to strike the tuning fork, put it on your mastoid bone. You tell me when you can no longer hear it, and then I'm going to put it in front of your ear, and you can tell me when you can no longer hear it then.
No. No.
Okay, good. So it's important to watch the clock while you're doing that, because the air conduction should be twice as long as bone conduction. And one more test, I'm going to stand behind you, I'm going to whisper a couple words, and I just want you to repeat whatever words I whisper, okay?
Nut. Orange.
Okay, good. So moving on from the ears, I'm going to look at the nose. So I'm just making sure the nose is midline in the face, making sure the bridge is midline in the nose, looking for any obvious deviations of the nose. I'm going to look at inside the nose. So can you lift your head up? Looking at the nasal mucosa, making sure it's pink and moist. The turbinates are pink and moist, and there's no obvious septal deviation. I'm going to palpate your nose and just let me know if you have any pain at all. Feeling for any nodules as well. I'm going to check the patency of your nose. I'm going to have you cover one nostril and take a big deep breath in and out. I'm going to have you cover the other nostril, take a big deep breath in and out. Okay, good. So now we're going to move on to the mouth. So I'm inspecting the mouth. I'm looking at the lips, looking for any cracks or skin lesions or any skin sores, which there are none. Then I'm going to have you open your mouth. I'm going to look at your teeth. Open your mouth. I'm looking at the color, the characteristics, looking for any, open your mouth, looking for any cavities, looking at to see if he's missing any teeth. And if you stick your tongue out, look at the color, the symmetry of the tongue. I'm going to have you move your tongue from side to side, sticking it out and up and down. So full range of movement of the tongue. Okay. Then I'm looking inside your mouth. I'm going to have you open your mouth and say ah. So I'm making sure the buccal mucosa is pink and moist, the gums are pink and moist with no edema, and the hard and soft palate. Can I have you lift your tongue up? Looks good. Okay. So then I'm going to look further into the mouth at the oropharynx. So I'm looking at the anterior and posterior pillars, looking at the posterior pharynx, looking at the vulva is midline, looking at the tonsils, and I'm assessing for any bad mouth odor, which there is none. So I'm going to test for the vagus and hypoglossal cranial nerve. So I'm just going to have you open and say ah. Let me test the gag reflex. Okay, sorry. Okay, so I'm moving on from mouth, I'm going to go to the neck. So first I'm just assessing the neck, looking at the symmetry, making sure that the trachea is midline. I'm looking at the JVD on both sides, making sure there's nothing blocking it, which it looks good. I'm going to palpate the carotid on each side. And I only do one side at a time, never do both sides at the same time. Okay, then I'm going to test the range of motion of your neck. So I'm going to have you look up and look down, look to the side, and to the other side. Okay, push against my hand over here, and push against my hand over here. Okay, good. Then I'm going to test the cranial nerve number 11, which is the accessory nerve, and I'm going to have you shrug your shoulders for me. Okay, good. So then I'm just going to palpate and make sure the trachea is midline. which it is, I'm going to have you lift your head up a little bit and swallow for me. Palpating the thyroid, which feels normal. Okay, so then I'm going to move on to your back. So I'm going to have you turn your legs around and sit so you're facing the wall for just a little bit. I'm going to take this down. Okay, so I'm just assessing the thoracic configuration of the back, looking at the skin, looking for any skin lesions. I'm going to palpate for the CVA tenderness, so I'm just going to put my hand on each kidney and you let me know if you have any pain.
No.
Next, I'm going to test the chest expansion, so I'm going to have you take a big deep breath in and out. Expansion is equal bilaterally. Next, I'm going to test tactile fremitus. So I'm going to have you say the word 99. 99. 99. 99.
99.
And 99.
99.
Okay, good. So next I'm going to percuss the back. So over the lungs it should be resonant, and then whenever I get to any organ it should be dole. And I'm going to do this in a systematic approach, so going from left to right and up to down. Okay, so then I'm going to test for the diaphragmatic excursion, testing for resonance to dullness. Upward, and then I mark that spot and then I work my way downward, testing from resonance to dullness. And I mark that spot and it should be between 3 and 6 centimeters, which it is. Okay, so the next thing I'm going to do is I'm going to percuss the lateral aspects of the lungs. Okay, and now I'm just going to listen to the lungs. So I'm going to have you breathe through your mouth. I'm going to listen to the lateral sides of the chest as well. Okay, good. Okay, I'm going to have you turn back around towards facing me. Okay, so now I'm assessing the anterior chest. So I'm looking at the skin, looking for any obvious deformations, looking at the symmetry of the chest. I'm going to palpate the chest. So I'm just going to palpate the precordium, checking for any thrills, heaves, or pulsations. And I'm checking the left chest for the apical impulse, which is strong and normal, which is good. Next, I'm going to test for tactile fremitus. I'm going to have you say the word 99 again.
99. 99. 99. 99.
And that's equal, vibrations equal throughout, which is normal. Next, I'm going to percuss. So I'm going to hopefully hear resonance to dullness, resonance over the lungs, and then dullness over an organ. And I'm going to do this in a systematic approach as well, as I did on the back side. I'm going to have you take your gown off so I can do this. Okay, the next thing I'm going to do is percuss for the liver borders. So I'm just going to go from resonance to dullness until I hear the dullness, and I'm going to mark my spot. test for the spleen, which should be between the 6th and the 9th rib. So the next thing I'm going to do is I'm going to listen. To the lungs, so just breathe in through your mouth. Okay, good. Next thing I'm going to do is listen to your heart sounds. I'm starting with the aorta, pulmonic, Erb's point, tricuspid, and the mitral. Lung sound, or heart sounds are all normal. S1 and S2 are audible with no murmurs and no gallops. Okay, the next thing I'm going to have you do is lay down flat on the bed. No, put it away. I'm going to first have you bend your knees. Okay, so now I'm doing my abdominal assessment. So I'm assessing the abdomen, looking at the characteristics, looking for any pulsations, any movements. I'm going to look at the contour with my pen light here. It's flat. Okay. The next thing I'm going to do is listen to bowel sounds in all 4 quadrants. Okay, bowel sounds are present in all 4 quadrants. The next thing I'm going to do is use the bell and my stethoscope and listen to the vascular sounds. So I'm listening to the aorta, which is midline. I'm going to listen to the renal bilaterally. Listen to the iliac bilaterally. And I'm going to listen to the femoral bilaterally. Okay. Next thing I'm going to do is percuss the abdomen. Just to get a general tone, it should be tympanic. Any dullness would indicate an organ. Next I'm going to do is just lightly palpate the abdomen in all 4 quadrants. Next thing I'm going to do is lift your head up a little bit. I'm going to test the abdominal muscles, which are fine. Okay, you can relax. Next thing I'm going to do is deeply palpate the abdomen. So I'm going to deeply palpate so I feel the aorta. Okay. Deeply palpate for the liver on the right side. And then deeply palpate for the spleen on the left side. The spleen is not palpable, which is a normal finding. And I'll deeply palpate for the bilateral kidneys, so for the right kidney. Palpable, and the left kidney is palpable. Okay, all right, you can sit up. I'm going to assess the lymph nodes, so I'm going to start with the preauricular. Let me know if you have any pain or anything with this. The postauricular, the occipital, the submandibular, the submental, the tonsillar, the superficial cervical chain, the deep cervical chain, and the posterior cervical chain. Now you take a breath, sit straight up. The infraclavicular, the supraclavicular, and the axillary, which all feel normal. Okay, next thing I'm going to do is look at the upper extremities. So I'm looking at the shoulders, the upper arms, the forearms, the elbows, the hands, the fingers. So I'm just testing the temperature, looking at the hair distribution, looking to see if for any muscle atrophy, looking at the fingernails. Let me put this on the other side. Okay, looking at the fingernails, making sure that there's no clubbing, testing the capillary refill, which is brisk, less than 2 seconds. On this side. Fingernails look good, and capillary reflex is brisk, less than 2 seconds. Next thing I'm going to do is test the strength of your upper extremities. So I'm going to have you put your arms straight out for me and push down. Okay, now push up. Okay, now go like this and push down. Okay, and push up. Okay. Full range of motion and our 5 out of 5 strength in the upper extremities. So next I'm going to go to the lower extremities. So I'm just looking at the thighs, the knees, the lower legs, the ankles, the shoes. Can I hear you take your shoes off? Okay, so I'm just looking again at the, I'm palpating, feeling the temperature, looking at the hair distribution, making sure it's even, looking for any skin lesions. I'm looking for any edema in the lower extremities. I'm going to palpate the pulses. I'm going to start with the upper extremities. I'm going to palpate the brachial pulse bilaterally, which is 2+, strong. And the radial pulse bilaterally is 2+ and it's strong. Okay, next I'm going to test the popliteal pulse, which is a 2+. The posterior tibial pulse, which is a 2+. And the dorsal pedis pulse, which is a strong and a 2+. I'm also looking at the toenails, looking at the for any clubbing or looking for any abnormalities, testing the capillary refill of the toenails, which is a brisk, less than 2. Okay, and less than 2. Next, I'm going to have you test the strength of your lower extremities. So I'm going to have you push against my hands and then push up. Okay. So then I'm going to have you stand up. You can put your shoes back on. I'm going to have you turn around. Can I take this off because I'm looking at the spine, the cervical spine here. So I'm going to have you go this way. I'm going to have you bend over straight. Okay, and bend and looking for any curvatures, abnormalities, or anything whenever he's doing this. And stand up straight. And bend backwards. Okay, stand up straight and then move side and straight, and the other side and straight. Okay, so the spine looks good. You can put this back on. Next, I'm going to test the reflexes. You can have a seat. So I'm going to test the brachial reflex. Just relax this now. The Achilles tendon, bilaterally, and the knee. Okay, the last thing I'm going to do is I'm going to have you stand up right here. I'm going to have you walk, turn around. I have you walk over here from your heel to your toe. And then walk backwards. No, just turn around and go. Okay, no difficulty. Okay, you can have a seat. So that concludes my full physical, head to toe physical assessment. Thanks for your cooperation.